the thing about the peptides, right, is it's not Miracle Grow, right? It's not a cure-all. I would strongly suggest that people approach them with cautious optimism and not fear, okay? If you're guided appropriately and your provider is competent and trained, which they should be, they should help you screen the risk factors. The potential of what they can do for you is really great. And there is a lot of clickbait online that goes both overestimating the benefit of peptides and creating a lot of scaring or harmful information about peptides that's out of context. So I would encourage listeners to try to screen away from anything that's polarizing in the peptide world and find a provider that they align with and that they trust to go through this process, because it can be something so beautiful and so transformative.
You're listening to the Gabe Molina podcast.
But like, I started doing like exercises based on things that I needed to do, right?
Yeah, which makes sense. I mean, that's literally rehab. It's like, here's a problem with a lot of people's mindset, and I think it comes from the standard medical model of you're hurt, you're broken. It's like you're just not resilient enough for the task that you're demanding your body to do at the moment. Mm-hmm. So how do you fix that? You gradually improve the resilience of that task and your capacity for it. So like, think about what you struggle with, and the most foundational way to alleviate it is do forms or fragments of that movement in a way that you can progress and get harder and stronger at, and then eventually you can do it better.
So I'm having epiphanies on shit people already know.
Yeah.
Okay.
But actually, I'll say a lot of people don't know that. So you're ahead of the game.
You know, I will say I'm super excited because this past week was not a great exercise week. I did the movements and, you know, the body moving thing, but, you know, busy with Mr. Brown, working. It's been a lot of friggin' work. But last week, I was able to do, I think it was 53-pound kettlebell swings.
Nice.
And I love kettlebell swings. I really do. They're, I think if you can do them, they're a great exercise to do. And so years ago, our neighbor was a certified Russian kettlebell instructor. So we would go there all the time.
Very cool.
Never felt better, man. Mm-hmm. Never felt stronger. Never felt more stable. You know, even, it's funny because, you know, a lot of the heavy metal people are like, I'm getting my cardio doing the weights, right? Mm-hmm. And there is some of that. So, but that also happens in the kettlebells. So I've always wanted to get back to that. Now, I will say when I first started, it was kind of tough because I only have, I have some lighter ones, but I wanted to do the heavier kettlebell, right? Just because, I don't know, I feel like I stay tighter and everything else in my swing, but I kept rocking, you know, so I'd have to be real careful. In the very beginning, I was kind of losing my balance forward and backwards. But after a little bit, I ended up getting to where I was like, okay, you know, you find that pocket, that sweet spot, you know, and it's like, okay, I'm balanced, I'm swinging, and now let's just keep going, you know. And that was last week, and I tell you what, man, I haven't been, this sounds stupid, and it is stupid, but I feel like the older I get, there's fewer, and this is just me, the older I get, there's fewer instances where I'm like, dude, I'm proud of you.
Yeah,
right?
oh, sure.
Fucking kettlebells was one of them, man. The kettlebells was where I was like, okay, we're not back to where we were when we were doing consistently with Elise, but it's like when we started seeing each other, like kettlebell swings, 50-pound kettlebell swings were not a fucking option. You know, it's like, no way, you know, that's never going to happen. But it's that thing where you say, you know, to cross that line to say, okay, now I can start getting stronger. And where before I was kind of in a strength deficit, you know, now I see that I'm at a point where now I just need to be consistent and keep pushing, and I can get even stronger to where that back pain is going to go farther away from me. So.
Correct. Yeah. And the reason the kettlebell is such a unique movement and why you like it so much is everything you do on a kettlebell, no matter how you do it, is posterior chain dominant. And that's why it's different than classical weight training. No matter what you do, like if you do an overhead press with a kettlebell, your whole backside is having to stabilize that overhead. It's not a shoulder dominant movement, even though it looks like it is, like a conventional dumbbell maybe, because the weight's very symmetrical. Because the weight is always offset and it's always going to be on the backside, right? Because that's how you hold a kettlebell. The backside is always going to have to over-engage in order to perform the movement. The same is definitely the case, obviously, with a swing or a deadlift or a squat. It just engages the whole weakest part, classically, of the human body.
Yeah.
Like, we are all so weak on the backside compared to the front side because of how we live our life. And it's even further emphasized in normal weightlifters because they really don't use a lot of their posterior chain. You know, you're doing a bench press, you're doing a squat, maybe a little bit of a deadlift, but still it's not an off-centered way, right? A deadlift is very controlled movement, even though it's posterior chain. A kettlebell is so off. You have to engage so much of these things that are necessary for stabilization in the real world.
Yeah, like, so it's funny because like with the heavy weight doing that swing, when I was finally kind of in that little zone where I was comfortable, I was balanced, and I felt good, like I feel strong through the floor. Like that sounds weird, but it's like I feel strong in my forearms, in my upper arms, my back feels tight in a good way. You know, your glutes, your thighs. And it's like even through the bottom of my feet into the floor, like I feel connected to the floor when I'm balanced doing heavy kettlebell swings. And man, it's a good feeling. So
It is.
yeah, no, so I was super excited about that the other day. So as a matter of fact, I even took a kettlebell to Nina's dad. So I've got one there, and Nina gets upset because she wants everything in the corner, and I'm like, I need it in the middle of the floor. That way, when I walk by it, I'm like, dude, swing it a little bit. Or pick it up, you know, or I may be watching something on TV and I'll grab it and let me just do like a single-handed farmer's walk back and forth while I'm watching the show. Or even just standing there holding it in tension, you know. And so I've got to have it in my face, in the way, or if it's in the corner, it's going to stay in the fucking corner.
Sure,
man.
sure.
But we're here today. Again, thank you for coming again, Dr. Justin Reyna.
Glad to be here.
We kind of got started and went off on a tangent, but we're here to talk about peptides. So I did a crash course on peptides the past week or two, and I've learned that it's more confusing than when I started learning about peptides. So I got a lot of questions for you. One in particular, and I'm gonna ask you this like I'm a 3-year-old, because some aspects of when I'm reading on it or watching videos on it, I feel like a 3-year-old. And I'm gonna cough real quick, but one thing that I hope we can kind of get to meat and potatoes today, because some of the things that I've read, and you're probably going to say the same thing. I know you will, because there's reality to what I've been watching and seeing. But a lot of it is that I've seen people talk about, or things that I've read, is like peptides are great, but you got to be careful, right? And I was even kind of doing some research, and I guess there's some direct-to-consumer type peptides that people can buy. And everybody that I've seen talk about it or read about it, they're like, don't do that. There's a lot that goes on there that people, and I feel like a lot of times people want to go around the doctor thing. You know, we kind of talked about it a little bit earlier too, but I feel like it sounds to me like there's different types of peptides that do certain things, but there's also some, and I don't know if it's all peptides or just a certain peptide where could potentially, if cause cancer to grow. Let's say you had cancer cells and you didn't realize it and you started taking these peptides, you know, things could get out of hand. So it sounds like there's a lot to them. You know, it sounds super simple to the layman, but it sounds like we need to put a lot more research into them before we start allowing these things to go in our bodies. But you're gonna be able to explain all of this stuff. And it's funny because I'm continuously talking right now, because I feel like you're that little car that got pulled all the way back. You're just waiting for me to let go so you can just take off. And so give me the floor, man.
Man, you literally laid it all out. So everything that you mentioned in that introduction is the reason why I wanted to do this podcast in the first place. There's a lot of misinformation on peptides. There's a lot of fear about peptides. People are accessing them through unsafe means without guidance. And in the same regard, peptides can be very simple, but they can also have some complex elegance to them as well. And that complex elegance is where they become extremely, extremely useful whenever you work with a provider that has the capacity and understanding of how all these systems interact with each other. It's a very intimate interaction, and we need to recognize that the human body does not exist within a vacuum. Everything affects everything. And if we know what we're working with, if we're doing detailed testing, detailed history taking, then we can utilize these really incredible signaling molecules to cover large blankets of human physiology, upregulate and downregulate the things that we want to or don't want to have happen in the body, and produce some really incredible outcomes. Now, what I will say is peptides have been around for a very long time. They are not a new thing. Most of the peptides that we talk about, and we will talk about today, were studied in the 70s, 80s, and 90s. Some of the peptides, such as the oldest one, the first one that we discovered, is insulin. Insulin is a peptide, and it's become, used in standard medicine. So it is my hope that eventually many of these peptides become standard medical practice. But they are relatively new in terms of how we're using them with the human body, and they're going to continue to extrapolate and grow because their capacity and their outcomes are truly magnificent.
Let me ask you this. Let me stop you real quick because I feel like we're going to head in a direction, and I kind of want to do this thing. So peptides are just a certain string of proteins, right? Now, we create peptides in our body, correct?
We do. So just to clarify, we have amino acids, which people typically will take like as a supplement post-workout for recovery. A chain of amino acids that are held together by a peptide bond.
Oh, so it's not a protein, it's an amino acid.
It's one step below a protein, and It's not an amino acid either.
Oh.
It's a chain so you have amino acids. Think of amino acids as a word. Okay. Apple. That's an amino acid, right? Think of peptides as a very specific text message. Hey, Gabe, I'm on my way. I'll be there at 3:00. It's now not just a word. It's a sentence with a very specific message.
So, okay, I'm starting to click a little bit. That's a great way to put it because now I'm kind of getting it. So you can take a strain of these words, right, and create a sentence specific to what you want done to your body.
Exactly. So you create this really specific signal to the body to perform a very specific function.
Now let me ask you this: that's a peptide?
That's a peptide.
So is Gabe's Pharmaceuticals making a peptide to say, "Hey, I want to increase muscle mass on Dr. Reyna"? Or is it a matter of, hey, we're going to take, or is it a matter of a doctor saying, hey, I'm going to go get a whole bunch of these peptides and we're going to create a shot that's going to do what we want? Does it come pre-made, or does the doctor mix that combination of peptides or words to make a peptide to do a specific thing?
Good question. So peptides come set. So there are a multitude of different peptides. So for example,
it's like me buying insulin. It's already put together.
Correct. It's already put together. So we would select a certain peptide for a function. Now where it can get really interesting and fun and nuanced, and what I like about it is you can use multiple peptides that can have a synergistic effect in the body, an effect that complements each other peptide. It makes them significantly more powerful than they are on their own. And that's where you really need to understand physiology, how the systems interact, and what's actually taking place within your patient's body.
And I guess in addition to that, like let's say I was going to get on peptides, right? There's a lot to consider, right? There's probably my weight, my age, my lifestyle, diabetes. So because I guess you want to put together a strain of peptides, they're not going to impact those things negatively. As a matter of fact, you're probably wanting to reverse that because of the peptide, right?
Correct, yeah. So like a peptide that would be particularly useful with your health history is perhaps something like trizepatide, right? we've talked about the GLP-1s and the GIPs. These became really popular with semaglutide or Wegovy, Ozempic coming on the market a few years back. And they've since taken that and they've created more potent synergistic forms of it. So the Ozempic was just a GLP, which is a glucagon-like peptide agonist. So with blood sugar regulation, we have this really intimate relationship between our pancreas and our liver. Our pancreas releases insulin. Insulin binds to our muscle cells and our fat cells, and it signals to them to pull in the glucose. Insulin itself does not modulate your blood sugar. It is a signaling molecule that has to bind to a receptor, send a signal, and then your body performs a function. Okay? The antithesis or the opposite of insulin is something called glucagon. So if insulin is released when your blood sugar is high, there's something in our body that's released when your blood sugar is low, which is glucagon. And so what this does is instead of having glucagon work against you, it biases that system so that your insulin can be a little bit more stabilized and your overall glucose is more stable. So somebody that is a type 2 diabetic, they may be on metformin, and their doctor may also suggest that they take trizepatide as a synergist to help stabilize their glucose. It also helps slow down digestion, which is critically important for stabilizing glucose. It is also a satiety agent, so it can help with hunger cravings. Many people will take it, and it regulates a neurotransmitter in their brain called dopamine, and that dopamine is the main driver for hunger and food. That's whenever people eat and they're not necessarily hungry.
Dopamine's an asshole. Trust me.
Dopamine is a very powerful lever. We need it, but it can work against us, especially in modern society.
You know what's funny is I've often said, I've talked to people before, and people are like, well, hey, why don't you go get surgery? And you know, it's funny because, like, maybe I overthink it. And sure, the surgery is a good probably jump start on things. But I've often told people my issue is my relationship with food, right? And I think we've talked about this before. It's like, you know, you're sad and bummed out, you go get something to eat, right? You want to celebrate, we go get something to eat. And there's that dopamine kick every time you, this sounds terrible, but fuck it, we're putting everything out there, right? Like there's times where like I have a craving of what something feels like when I eat it. Mm-hmm. It's not even the taste or the nutritional value. It's like, how does that feel when I bite it? You know? And it's funny because even that's a struggle. So it's not a matter of, hey, I'm hungry, what should I eat that's going to be good for me and feeling. You know, there's this whole, what does that feel like when for a real fat dude, there's this, what does that feel like when I bite it? You know? And then all of a sudden, you know, your thoughts on caloric intake and how it's going to impact your body, all that shit goes out the door, right? It's like, how does this donut feel when I bite it? You know, and it's like, okay, well, there's a donut with a hole, but the donut without the hole feels even fucking better.
Sure, yeah.
And like, this sounds stupid, but for a real fat guy, that kind of goes through the brain, man.
Yeah, you know, it does. And what I tell people a lot of the time with overweight patients is it's not that they don't want to lose weight if that's what they're trying to do. It's their physiology is working against them to lose the weight. Right? That dopamine that somebody may get from the food is no different really than the dopamine that an alcoholic might get. A dopamine that somebody that engages in risky sexual behavior may be getting, or somebody, you know, it could be anything, right? Everybody has their dopamine leverage point. But what's really interesting to understand about dopamine in particular is it works on this seesaw between a pleasure standpoint, right? We get pleasure from dopamine, but in order for our dopamine to come back to baseline, and in fact it drops below baseline after we engage in that pleasurable behavior, we then experience pain, right? So there's this pleasure pain seesaw that takes place with all dopaminergic behavior in the body. So somebody, for example, you'll hear these really high level athletes, they'll compete, they'll win the gold medals, and then they're depressed afterwards, because they engaged in an activity that was so stimulating, it was so dopaminergic to them that our physiology had to reset itself, and they experienced pain in the form of depression.
Oh, I see.
And this can be really with a lot of different behaviors. For example, that's why cold plunging has gotten really popular, because you're engaging in something that's uncomfortable. The more uncomfortable things you engage in, you start to reset that dopaminergic standpoint, which is another reason why exercise is critically important during the process of weight loss, because you need to engage in strenuous activity. Weight loss, behavioral change is not just the act of changing behavior, but changing neurotransmitter status, right? Which is why
So you can train that stuff to behave different, or you can train yourself to translate that information differently, I guess.
100%. Yes. So what can work against you can also work with you if you know what you're doing. And that's why in the case of somebody going through that understands that it's not that they want to eat the food, it's this desire that they have, right, that's working against them. So if you can utilize a peptide like trizepatide, for example, to give you a safety net in that process, it can help you become more successful with your goal as you're going through all the lifestyle and nutritional changes. It really is just designed to support you if it's used in the right mechanism.
So trizepatide is what we're talking about currently, but is there another peptide or group of peptides that people can take to kind of balance out that mental portion of it, where it's like, okay, we've got this high and this low, but we want to stay more balanced? Or is it just that in combination with putting yourself through stressful things and preparing for when something really stressful comes? You know, as you're talking, I'm thinking about not even physical fitness. Like, I'm thinking about, we were talking earlier about sick old folks, right? And having to be there for them. And it's interesting because, like, I had a conversation with my wife recently where it's kind of like, hey, you're just going to take it day to day, you know? And I've been like this my whole life, where I get depressed, I get upset, everybody does. But my whole life, I've been, even especially through work, I've had that mentality of, like, things get so bad that it hits this tipping point. And I think where a lot of people would maybe, that stress would cause them to decline mentally. Like, it's very stupid. This sounds so dumb. But, like, when I get there, all of a sudden it becomes funny to me. You know, it's like there's so much going on. And it's everything's on fire. And there's times where I'll be sitting there and I'll just start saying fire, fire, fire. And Nina's like, what are you talking about? I'm like, everything's on fucking fire right now. But it's kind of like I get to this point where everything's just so out of control that I almost start to relax a little bit, you know? And then I slowly start to eliminate things that are kind of BS in my life currently, because everybody likes to take on a little extra stuff. And then I start hyper-focusing on the important things. And like for Nina, she gets really stressed right now because, you know, she's been helping with her dad. But it's almost like the more things that come at you, it's like being in the gym every week, right? Or every day, 5 days a week. Mentally, the more things that come at you, the more you learn to cope with them. And then as negative things come at you, they're less strenuous on your psyche, right? Which is physical body, the same thing with the gym or doing the cold plunge. I guess I'm just reiterating what you just said, in the sense that we have to put ourselves in uncomfortable places so that we're prepared for when we're put in uncomfortable places.
I would agree with that. So the exposure to difficult activity improves our physiologic or our threshold to withstand difficulty. But one point that I would like to make really clear, that doesn't mean that we should accumulate stress so much so that it desensitizes us and we become disconnected from our body.
Oh, yeah.
Which is something that it sounded like you were explaining to me right now.
Yeah.
Right? Because you get so overwhelmed that you get to a point where you aren't overwhelmed anymore because you become desensitized, you've blocked it out, or you're no longer intentional with your thoughts and feelings towards these things. And I think that happens to a lot of us, especially in, you know, standard American culture, which is very grind heavy.
Yeah.
And peptides can certainly help support those different things. The reality of it is it's extremely difficult to do everything perfect in our health, right? What I will say is, because peptides are signaling molecules, they are not the end all be all of everything. You cannot just take them and throw everything else out the window. The healthier you are, the better they're going to work. The more baseline or foundational health you have, if the soil is rich within the body, the water and the nutrients that you put into it are going to yield something really beautiful. That does not also mean that if you're unhealthy that you shouldn't take a certain peptide. Everybody can benefit from them for the most part. It's just understanding how you can get the most benefit from them, right? So in order to understand these peptides, I would say that there's 4 major categories of why they're being used right now. One of the reasons that they became particularly popular is because of the regeneration and recovery aspect of certain peptides. There's also immune modulating peptides. And immune system is very important to understand that it's not just getting the cold and the flu. The immune system is a major part of recovery and how we feel throughout our body. And I'll explain that in just a second. The third and another reason why peptides have become critically important and very popular, especially in the United States, is because there's a branch of peptides that are useful for metabolic and endocrine or hormone modulation, okay? And then lastly, we have our neurologic peptides, right? So there are certain peptides that can upregulate something called brain-derived neurotropic factor. This BDNF is essentially like fertilizer for the brain. It allows the brain to remodel and grow at an accelerated rate. There's also specific ones that you can take to downregulate neuroinflammation. So our brain is a vascular structure. We have something called the blood-brain barrier, right? The blood-brain barrier acts as a bodyguard, if you will, for what gets into the brain, but it's not able to keep everything out of the brain. And so we get these inflammatory molecules that make themselves into the brain, and they cause inflammation. And that inflammation over time causes damage to the brain. It also affects the way that we interact. We can be, foggy-minded. We can be fatigued. Our vestibular system, which is part of the brain, right, because it's innervated by the cranial nerves, that's our balance system can be thrown off after you get the flu or you get an infection. In fact, that's something that I've seen recently as we've transitioned from the cold spell that we've had. A lot of patients have been coming in with some type of viral infection. Looks sort of like allergies, not quite lining up like allergies. Everybody's testing negative in these cases for flu and COVID, but they're getting this viral upregulation, so their immune system is stimulated, and it's been affecting their balance or just different things that you wouldn't typically associate with getting sick, even after they're not sick anymore. And really what that is it's neurologic inflammation.
So will there ever be a case, or maybe this is a dumb question, where somebody might be utilizing all 4 of those?
I would say you could. I think that throwing spaghetti at the wall is probably not the best approach for things. In my world, I would rather target things maybe a little bit more specifically. My grandfather, so we talked a little bit about him on my mom's side, World War II veteran. I would say I would classify him as a hard ass. Have you ever watched Gran Torino?
Yes.
That was my grandpa.
Oh, really?
Yes. So
I would have loved your grandfather.
So he's a farmer. He's been a farmer his whole life. And growing up, we spent all of our holidays and extended weekends and everything at my grandparents' farm. And so we'd wake up, before the sun was up, we'd always have 2 eggs, toast, some bacon. He'd read the newspaper, and then we'd go work. And then he just knew without a clock or a watch when it was time for lunch. And then we'd come in for lunch, we'd eat again, and then we'd go out and work until the sun started to go down. And he was just a very particular type of person, right? Gosh, why was I even talking about him? What were we talking about?
I think we were talking about him getting free labor out of the kids.
Yeah, right. Something about him being a hard ass, and I don't even remember the point where we were going down there.
I'm not sure. Huh. I think we were talking about the different types of peptides initially, in what you said you didn't want to throw spaghetti at the wall.
I remember now. So you can edit that part out where I blipped. So with my grandpa, and the reason I brought that up is he always told me, because I tried to do too many things at once. I wasn't as savvy with tools as he was, obviously. It's everything that he knew. He always said, Justin, take that tool out of your left hand. You can't do 2 things good at once, right? Same thing goes with peptides, right? Okay. If you cannot try to heal, lose weight, improve your brain, improve your immune system, gain muscle, run faster. You can't do all of that at once. And if you try to, you're not going to do any of them great, right? So understanding what the hierarchy is, and sometimes the patient will think that this is the hierarchy, but in reality, in order to get to that goal, they need to do some of these foundational layers first.
Okay.
Right? So like, I'll give an example of something that's not peptide related that is important for peptides. One of the most important health labs, in my opinion, that we can run on somebody is what's called an omega index. And what that checks is your omega-3 to your omega-6 ratio. And it also breaks it down into these different things called DHA, DHEA, EPA, prostaglandins. These are all of our anti-inflammatory and inflammatory modulators with fats, right? So many Americans, because we don't typically eat fatty fish, avocados, flaxseed, all the really good fat type things, olive oil, we eat a lot of seed oils and inflammatory fats. Our omega-6 is typically high and our omega-3 is low. Now, omega-3 is critically important, and I actually wrote about this in one of my master's degree thesis, is it's critically important for reducing neurologic inflammation, okay? It improves our sleep quality and our recovery from exercise and resilience. Another thing that omega-3 does is it improves the communication from cells to cells. Cells have these things, we've all probably heard this word at some point in biology class, but we threw it out with the Krebs cycle and all those other things, is we have this thing called a phospholipid bilayer around our cells. And this bilayer keeps water molecules from coming in unless that water molecule is attached to a fat. Well, that omega-3 improves the capacity and the permeability of nutrients and signals to communicate from this cell to this cell. I would say that's critically important if you're trying to use a peptide, which is a signaling molecule. You want to make sure that these cells are more efficient at receiving signal, as well as if you're taking something to reduce inflammation like BPC 157 and to improve healing, that it would work better if your body has the ground substance to resolve inflammation, which are these omega-3 fatty acids, right? So a patient may suspect, well, I'm just going to take this peptide and it's going to reduce my inflammation and I'm going to heal faster. Well, yes, it will help with that, but it's going to do significantly better if your omega-3 levels are good, if your vitamin D levels are good, if X, Y, and Z is doing well, because that's all supportive of the same thing you're trying to achieve, but it's foundational health. Does that make sense?
Yeah. You know, it's interesting because like I'm every example you give that's negative, that's pretty much me. So, but it's testosterone is its own thing, right? But if you, or is it a peptide as well? Can you get a peptide for testosterone?
Okay, so to understand that, we have these signals that come from our brain that are called luteinizing hormone and follicle stimulating hormone, okay? So those signal to your sex organs to produce testosterone.
Okay.
So if you have a signaling issue from your brain, you could use certain peptides for that. If it is not a signaling issue, those peptides will be ineffective, which is another reason why it's important to work with a provider and to run labs, because you can purchase these peptides that, let's say they're marketed for testosterone increase, but you don't have a signaling problem, and now you just purchased a vial and you're producing very expensive urine.
You see, this is where my limited research took me, where I was like, this is complicated, or it can be complicated, because testosterone, low T's a motherfucker, man, I ain't gonna lie. And I'm sure I've been low T'd for a while. Testosterone affects a lot in a man. So to be able to maybe possibly take a peptide that's going to help with testosterone, through that, producing more testosterone is going to help in other aspects, right? So we may have multiple issues, and correct me when I say something stupid, because I'm sure I'm going to. If testosterone helps with multiple things, then we can take a peptide to help us with our testosterone, and that one peptide through the testosterone is going to help alleviate multiple issues. Is that correct?
It certainly could. So I'm glad you brought up hormones, because that's another thing that I'm really passionate about. And so I want to talk about men, but I really want to talk about women, because I think they're the most disenfranchised group when it comes to hormones, and it's really sad. So as far as testosterone goes, if you take testosterone, that's an exogenous hormone, right, which is certainly different than a peptide. And one of the reasons why it's different is because our hormone systems, for the most part, work on what's called a negative feedback loop. So if you introduce something, you now produce less of it when there's a negative feedback loop.
Okay.
Peptides do not work on a negative feedback loop, okay? But hormones do. So if you give somebody testosterone, and the reason why they have low testosterone is still present because it wasn't fully examined, evaluated, and there wasn't an intervention for it, that testosterone really just works as an amplifier for all the negative things in the body, okay?
Well, your body, I mean, you're already kind of decreasing your testosterone production, but if introducing in testosterone externally into the body, will that tell your body that it can turn off making testosterone even more so, or no?
Oh, yes, that's exactly what I mean by that negative
okay.
feedback loop, to
Gotcha.
clarify, yeah. So you'll produce even less of it. And there are some negative effects to that for sure. But what I will say is having adequate testosterone levels and exploring why they're low and working on those things can have one of the largest levers, not only on our health systems, but on our quality of life. For example, men that have low testosterone experience more anxiety. They're less, if I use the word bullish, do you understand what that means? Like, they're more timid. They tend to be more timid. They have more joint pain, particularly in their lower back and shoulders, right? And the libido will decrease as well, right? So having low testosterone...
I feel like you're looking through me right now. Go ahead.
Another point I will make is having adequate testosterone levels should increase muscle mass. So then you have more of a metabolic storage system for glucose. And glucose is the number one health regulator, right? If your glucose is up, it's too high, or if it's dysregulated, going too high and too low, the amount of impact that has on your body is, I cannot understate how important that is or overstate how important that is. Now, I want to pivot really quick to female hormones. We've talked a lot about testosterone in men.
Do we really need to do that? No, I'm joking.
Women for many years have been told that hormones can cause cancer, right? And so many women have gone through menopause and have not taken hormones, but their quality of life has decreased tremendously. They experience anxiety. They have night sweats. Their body changes in ways that they may not want or like. They lose sexual desire, have pain during sex. They have general pain throughout their body. There's so many things that happen. And the reality of it is there's so much research that's new and old that shows that it's extremely protective for your body to have adequate hormones. And in many cases, it's protective from the thing that they were afraid of to take them in the first place, which is cancer, right? There's lots of research that shows that having adequate testosterone, estrogen, and progesterone levels can actually protect you from breast cancer, right? And if you do get sick with whatever kind of illness, if you have adequate hormone levels, you're going to be more resilient, right? You're going to recover from that disease or sickness faster, right? And to that point, so much of the research with testosterone that we associate with positivity is actually because of the conversion into estrogen. The only time in women's life where they almost catch up to men for cardiovascular events such as a heart attack and stroke is postmenopausal. That's when they stop producing estrogen. Estrogen lubricates the blood vessels, the sphincters of our body, the brain. It controls the tone of the urethra. So many women postmenopausal or women that have low estrogen will actually experience chronic UTIs. And so then they'll go to their doctor and they'll get put on antibiotics over and over and over again. These antibiotics will cause damage to the gut. They also set you up because they kill the good bacteria, and that bacteria plays a major role in your blood sugar regulation. So then they're set up to have an increased propensity for diabetes or blood sugar issues. Then they have mental fogginess, and it perpetuates the cycle that's affecting their quality of life.
Is the medical industry starting to turn around on estrogen?
Well, yes. So a few months ago, RFK, he did eliminate the black box warning on estrogen. Okay.
What is that?
A black box warning is the highest level of warning that a medication can get. Basically, it means that this is a very likely thing to happen if you take this product.
Oh.
For example, there's an antibiotic class that is classified as a fluoroquinolone. There is a black box warning on fluoroquinolones for spontaneous tendon rupture. So if you take a fluoroquinolone, not only while you're on it, but for weeks and months afterwards, you're at increased risk for spontaneous tendon rupture. You can walk outside and tear your Achilles tendon. Something that can also happen.
What is this medication called again?
These are classified as fluoroquinolones.
Fluoroquinolone.
It's a type of antibiotic.
Okay.
You can have a artery dissection spontaneously. Really? Yes, because it permanently alters the matrix of the tendons in your body, right? So estrogen was put on that same level of warning for cancer, which is untrue. It was never based on appropriate science. In fact, it was based on skewed evidence from decades ago. And so for so long, women have been deprived of really the fountain of youth hormone for them.
It's interesting because I'm sitting here and again, mentally I'm a 3-year-old, right? But I'm sitting here going, if I produce, in women there's the estrogen, but if I'm producing something, whatever it is, right? It's testosterone. I don't understand how after a certain age, reintroducing that back into my body is going to be a negative thing after my body's been producing it for such a long time. So for women, the estrogen portion where it's like, okay, they hit menopause and, they're not producing estrogen like they used to, and we're going to reintroduce estrogen into their body. I don't know. It doesn't make it. Again, maybe I'm an idiot. It just doesn't make sense to me why it would be like, no, this is no longer good for your body, even though for 55 years or 60 years or whatever it is, you've been producing it.
Correct.
Makes zero sense, man.
It does make zero sense. But unfortunately, when you look at the research, that old research was done with synthetic estrogen, which is not processed the same way as bioidentical estrogen. So it's important to understand that there's two major camps of hormone therapy.
So is that a new deal, the
bioidentical? I wouldn't say it's new. It's probably been around since the 90s, I would imagine.
Okay.
It's been in the relative.
Still really, I mean, hell, we went to high school. Well, I went to high school in the 90s. You're still younger than I am. But. So that's new compared to maybe what they were producing in the 70s.
Sure,
80s.
sure.
Gotcha.
These bioidenticals are designed to be accepted in the same way that our own hormones are, right? And there are different types of estrogen in the body. There's E1, E2, and E3, and those are all processed differently. There's inflammatory ones. They go through different pathways. So really that research was done and it was accepted and it was processed through a non-critical thinking lens, which is unfortunately the case in many aspects of standard medicine. And I don't want to, downplay any type of profession, but that tends to be the big argument between my world and the standard practice is like, well, hey, if you critically think about this and understand how the systems work, what you're saying really doesn't make any sense.
Yeah. And I wonder why it takes people so long sometimes. And I mean, that's probably another conversation for another time, but it just isn't, it doesn't make sense that it, if it's something that you've been producing for such a long time and we're going to reintroduce it and it's not synthetic, right? It doesn't make sense why it would be a negative thing on the body, but
it's just because FDA hasn't approved it. Like, for example, FDA has still not approved testosterone in women. And so women, they have to go through non-standard medical providers, most typically, to get prescribed testosterone. Men don't, right? Which is extremely unfair. It's ridiculous. And unfortunately, that happens a lot in the medical world, is men have access to so many things so much easier than women do that improve our quality of life. But whenever it comes to women, they don't have the same access to it, right? Even though their bodies need it and they thrive when they're on it, and it improves their resilience, reduces muscle loss associated with aging, osteoporosis, which is a major problem in women, brain fog, libido. I mean, there's just so many things that give you the zest for life that hormones can do, and peptides in many ways. And I want both genders to have access to that.
The peptides, are they biological or are they synthetic as well? Or do they have two different types?
Good question. So peptides are naturally occurring within the body. So what we do is we copy that and we synthesize it in a lab. So it is not for example, BPC-157 is created in the gastric juices of humans. We're not taking gastric juices and introducing those back into people, but we're taking that same peptide chain and introducing it to people.
Okay.
So it is a bioidentical.
Gotcha. And so that's not a. And so I was listening to some stuff the other day, and people know none of the peptides are approved by the
FDA, yes. Mm-hmm.
So I mean, none of that stuff is. So that, I guess that's why. How does that affect people's usage of it? Is it something where certain doctors won't prescribe it because it's not, and they're concerned about maybe some negative effects from taking it, or how does that work?
Yeah, it's I think a liability standpoint for a lot of doctors. So the thing is the FDA reclassified them a few years back, and what that did is that created this major online market where people are predominantly getting these injectable chemicals.
And this is what we don't want to do.
We do not want this. And that's what happened, unfortunately, as a result, because people want access to them, right? They either don't know a doctor to get them from, or they're too expensive and they don't want to go down that route. And so what people are getting these chemicals that are produced predominantly in a Chinese lab, okay? We have no idea, number one, what's actually in it. Even worse, we don't know what's not in it, right? And then we don't know how it's shipped. We don't know the temperature that it's controlled in, the moisture, the light exposure, all of those things. Many of these peptides are also sold in a blend where it doesn't make biochemical sense to even have those blended together because they all exist at different pHs, right? So at best, you're getting something that doesn't work. At worst, you're injecting yourself with something that has toxic material in it.
Two negatives. So I guess somebody's going to come to your office. They want to get on a regimen for peptides. Where do those come from, as opposed to something that you're purchasing online?
We get ours compounded in a pharmacy.
Okay.
So the pharmacy is regulated. It is third-party tested. Everything's tested and produced within that pharmacy. So we know that this is a legitimate product that has a legitimate expiration date, and it's compounded by a licensed pharmacist.
Okay. And let me ask you this: when somebody's considering it, of course they need to come see a medical professional. But what are some of the, I guess, who are some of the folks who, I'm sure that under certain circumstances and depending on physically how they're made up, whether it's they're in great shape or in terrible shape, all these aspects that go into that thought process. But who is somebody who would not be a good candidate for peptides?
It's a good question. So pregnant patients, not because we know that they're unsafe, but because we don't know that they're safe.
Okay,
Does that make sense?
There hasn't been any, examples of things that didn't go well. We just don't know that.
Correct, because the only way we would know that is we would have to perform an unethical study where a patient a patient that is pregnant is taking a peptide which could potentially harm the life of their baby.
Gotcha.
So that study will probably never be done.
Right.
And I actually, in many cases, hope it's never done because of the potential of harmful outcome. So that would be a patient that we would say, hey, we're not going to do peptides. If a patient has active cancer, we also would not do that. Again, not because we know that it would cause a problem, but the consequence, if it did cause a problem, could be astronomical.
Yeah.
Now, what I will say is there is evidence that shows that some of these peptides can be protective of certain types of cancers and diseases. One peptide that I'd like to talk about, because it's received a lot of popularity for the most vanity aspect of this peptide, but it's so much more than what people are using it for. And this peptide is called GHK-Cu. That Cu stands for copper. And so we typically call this copper peptide. Now, the reason that people typically will use it is because you take this peptide and it upregulates collagen synthesis. So people will take it and call it the beauty peptide.
Oh.
It helps reduce wrinkles, improve elasticity and tone to your skin. People typically really like that sort of stuff, and I don't blame them for that.
Sure.
I recently started taking it. I use a topical and I use a liposomal oral, which is a very small particle to absorb, and I really like it. But that collagen synthesis is critical for tendon and ligament repair. It's also critical for gastrointestinal tissue repair. But what I think is the most fascinating, well, there's two fascinating things about this particular peptide, is it stimulates something that's called VEGF, and that's vascular endothelial growth factor. VEGF stimulates something called angiogenesis. Angiogenesis is the development of new blood vessels. So we need the development of new blood vessels in order to repair tissue. When a tissue's become damaged, or it's chronically inflamed, or it has edema around it, the vascular innervation into the tissues become compromised. So if we can improve that vascular flow via new blood vessel formation, we can repair the tissue faster. That's not just in our muscular system, it's in our brain, it's in our cardiovascular system, right? That's critical. As we age, we lose blood supply to areas. So if we have something that can help us reverse or reduce the rate at which we're losing that, that's pretty impressive.
Is that part of that copper peptide?
That is copper peptide, yes.
You know, what's interesting, and again, being fat, out of shape, and diabetic, I see it a lot in other people too. You know, I think one time when we had Austin here, we talked about the waddle, right? And it's interesting because, like, you know, you see that and you go, that's fat dude waddling. And as I became the fat dude waddling, it turned, you know, I talked to some people about it. And so one of the conversations we had was circulation in the lower extremities. And so it's interesting because there comes a time where you start to form edema in the lower extremities. You know, whether it's the heart pumping or maybe some of the blood vessels deteriorating or whatever it is, starts to live down in your lower extremities. And that waddle comes from the lack of movement in your ankles because they get so swollen. And it's interesting to see how if something can help with that circulation, whether it's you know, working with the arteries or working with just to get that blood flowing easier, to be able to get that blood up from those legs, to be able to move better, to walk better. And, you know, a lot of what I'm experiencing these days is because I'm seeing my old people get older, right? And it turns into this thing where you start to go, okay, well, there's so many things that maybe if we were to take certain peptides or of course, the fitness, the healthy eating, all that stuff that we've talked about earlier, you know, there's things that maybe can prolong that deterioration to where, you know, somebody's mother can go to church a little more safely and be able to walk more strongly and be more stable because they're getting that blood flowing out of there quicker. You know, There's the medias, right? Yeah, nobody likes putting medias on, man. Nobody likes having to take them off. But, you know, these are things that if we can introduce them to people early, to be able to help earlier on, might prolong that inevitable thing that's going to happen to them, might push that out a little bit farther.
Right.
You know, and ultimately it sounds like all this is quality of life, you know, and a lot of times we talk about quality of life at the end of somebody's life. And it's like, well, okay, why don't we work on that quality of life earlier? You know, and I'm just as guilty. I mean, fuck, I'm a fat guy out of shape at a desk job, right? So these are all things that like slowly come to the forefront of your mind. There's so many things that we put in the back of our minds. It's like, I'll take care of that later. You know, I'll go to the gym later. I'll go see the doctor later. I'll get blood work done later. You know, when I first became diabetic, I was super young. And it was so stupid because I was going to community college and working at a convenience store afterwards. And I remember my mom was like, you need to go to the doctor. You know, I felt terrible. I was lethargic. Dude, I would pee all the time. There were times where I would be in the middle of the night drinking water while I was peeing. Like I had this thirst that I couldn't control. And it was like, hey, you need to go to the doctor. And I've got to go to college. I've got these finals. I've got to finish these finals. I got to close the store tomorrow. You know, I'll do it Thursday. You know, my last finals Wednesday. I'll do it Thursday. You go to the doctor Thursday and he's like, you got to go to the ER. You know, so it's that weird mentality that I feel like we all feel like, I got time, let me put it off. And it's like, it's almost like checking the mail. It's like, even though I'm terrible about not going to the gym, but it's like going to the gym. It's like eating healthier. Like all these things, if we can see a physician and get looked at, take a look at our blood work and find deficiencies in there and things that we can do differently or introduce, you know, certain types of peptides early on, it's gonna increase our quality of life even longer. So
it certainly could. You know, there's a saying: it's a healthy man has 1,000 dreams, an unhealthy man only has one.
Yeah,
it's to be healthy, right?
Yeah, man.
You know, and health is one of those things that either you make time for it or you're going to be forced to have to make time for it. And, the peptides, they can certainly help, and especially in the preventative world, right? An ounce of prevention is worth a pound of cure. If you never have to cure something because you've been preventing it, your quality of life has been so good for so long.
Yeah.
And in the cases with the BPC 157 and the copper peptide, because those are our major angiogenesis or blood cell or blood vessel formation peptides, they could certainly improve blood flow, and like you mentioned, in combination with exercise and healthy eating and all the sorts.
When I hear blood flow at this age, I think of erectile dysfunction. So does it help with that as well?
Well, the thing is it may. There are certain peptides specific for erectile dysfunction. There's one called PT141. It depends what the cause of the erectile dysfunction is. Some people think it's blood flow. For a lot of people,
ugly girlfriend.
for a lot of people, it's the true signal from the brain, right? So we have this melanocortin receptor in our brain that signals to actually produce an erection for men, and the same thing for women. Obviously not erection, but the desire for to engage in sexual behavior. But on the topic of BPC 157 and copper, right? Stimulating all of this vascular formation can be critically important for a lot of age-related health conditions. And I think what's part of the reason why this anti-aging and functional medicine boom has taken place over the past, let's say, 10 years is because we are watching the older generation decline, and we don't ever want to get there. We don't want to decline the way that they did, following, taking the drugs and going to the doctor and everything feels healthy. And my doc says my blood work's good, I'm good. But you don't look good. You're not moving the way that you used to. You're not thinking the way that you used to. You're not engaging. You're not present the way that you used to. So are you actually good? Because in my world, in my mind, that doesn't just happen because you get old. You don't just get old and you just decline. You don't just die one day. Your organs shut down and they start failing you. And well before the day that you die, your systems stop working the way that they're supposed to, and you're no longer a vibrant human. Peptides have the capacity, if used properly with all of the important health systems and diet and exercise, sleep, engaging in loving conversation with people, having a community, to improve your quality of life so that your health span matches your lifespan, right? On the topic of copper peptide, that second function that I think is very fascinating is that it regulates anywhere between 400 and 600 genetic expressions. So we all have genes in our body, right? So for example, if there's a propensity of diabetes on my dad's side and there's a propensity of high blood pressure on my mom's side, right? And I kind of argue about those things back and forth because of the lifestyle that those people lived. But, people can live a lifestyle and never get high blood pressure or diabetes, right? So let's just say, for the example, Dr. Reyna has a gene for diabetes on my dad's side and not on my mom's side. And Dr. Reyna has a gene of high blood pressure on my mom's side, but not on my dad's side, right? So we have these two things, little a, little b, or little a, big B, little b, right? The way that I live my life, whether that is mentally, right? If I engage in argument, I'm frustrated all the time, I'm anxious, I'm stressed out. If I'm, staying hydrated, if I'm eating, if I'm in a good community, if there's inflammation in my body, all of those things act as a light switch. They can now flip on these different genes. Just because I have the gene for high blood pressure, just because I have the gene for diabetes, does not mean that I will ever experience it. And it also does not mean that I have increased risk to experience it. But if I'm doing certain things, those genes can turn on. And now all of a sudden I'm at greater risk to have high blood sugar and high blood pressure. Copper peptide is a gene regulator. So it turns off certain genes that have been associated with cancer, turns off certain genes that are associated with hypertension, turns on certain genes that are associated with recovery and vibrance. It's pretty impressive. Along with BPC.
That's very impressive.
It is. It is. Now, again, it's never going to bypass what you're doing, sure. Right? So if, X, Y, and Z, I'm doing all this stuff wrong, I'm still drinking, 10 beers a day. Well, yes, it's, it's going to turn it on.
And biting
and
donuts
off.
with no holes in it.
Right. On, then back off. On, then back off. Yeah. That sort of thing, right? But BPC 157, so what I'd like to point out is there's this molecule that we discovered about almost 30 years ago. We got the Nobel Science Award for it. It's called nitric oxide. Nitric oxide dilates blood vessels. Okay, the more dilated the blood vessel is, the easier blood can flow through it, so it should reduce blood pressure. It also reduces inflammation and stress on the vascular walls. The reason why that is because there's 3 layers within our blood vessels, right? There's the external, the middle, and then the most internal layer. And they all glide like this within each other in order to produce a contraction and to move blood and to move nutrients around. Now, you can experience a friction injury. It's really interesting. It's very fascinating.
The body's so complex.
It is. That's why it's so fun to learn about, right? Jeez. It's like the ultimate engine.
Yeah.
And so in the process of moving things around, damage can occur. We get that friction injury. So then our body turns on the release of what's called inducible nitric oxide. Inducible nitric oxide is very inflammatory. It causes damage. It's a no bueno. BPC 157 downregulates inducible. It upregulates endothelial nitric oxide. That's the good juicy stuff that makes the blood vessels nice and open, and it coats the walls of our blood vessels.
That helps to lubricate.
Correctamundo. Yes.
Gotcha.
And then the second thing that it turns on, that copper also turns on, is neuronal nitric oxide. Neuronal is blood flow into our nerves, our spine, and our brain, right? So now we can improve the rate at which those things regenerate. We can improve the rate at which they're receiving blood flow and anti-inflammatory nutrients. And we can reduce the rate at which those things decline. A normal process of aging is neurologic decline. But if we can slow that down, that's pretty awesome. And, it really didn't dawn on me the importance of that until I saw my grandfather decline, from 94 to 97. He started losing his mind, right? And it happened very rapidly. It went from he's a little bit forgetful to now he's hallucinating,
gotcha.
right? And it happens because, as we talked about before we started this podcast, the rate at which you're aging after 85 is insane, right? If we can do things to protect our brain, man, like, drinking lots of water, creatine is one of the most important things to take to protect your brain. Magnesium glycinate, these anti-inflammatory molecules that can get past the blood-brain barrier and saturate our brain with things that are reducing the hyperactivity in there, right? Like that, not only does it make us feel better, make us think more clearly, be more present, potential to be more loving with our loved ones in our community, but it allows us to actually extend our ability to think and love and interact as we age. And you do that for one person, and you can only imagine the rippling effect that has for their family and their community.
Sure.
And that's where peptides and functional medicine become so fascinating and so near and dear to my heart.
It's interesting because in a family, when somebody's struggling, you made me think about it when you were talking about the estrogen earlier. But a lot of times we kind of look at our loved ones or significant others or just family members in general, and we go, Gabe's an asshole, or Brenda's just being a dick, right? We don't take the time to go, what's causing this? My wife is a special needs teacher, and she's got a saying that I think is great. Behavior is communication, and we don't take into consideration, these women in our lives. I'm 49. I've got friends who are in their late 40s and early 50s, and it's interesting because, like, I'm just now seeing the menopause phase of that, And sometimes you sit there and you attribute these behaviors to them changing or just, I don't know what their problem is, but we don't think about what's happened to them, internally, whether it's with hormones and other things. And when you have a family where somebody's experiencing that and everything's out of whack, or they've got an older family member who's, has Alzheimer's or dementia, and it's starting to impact the family, it's very stressful. We don't take into consideration these types of things, right? And it will impact the family. You know, one person can make a whole family miserable. You know, so being able to maybe get to these things early medically, to be able to run blood work and see what's going on in the body, you know, even just to diagnose these things. You know, there's times where, you know, I had a grandmother pass away from Alzheimer's recently, and we had family members in the family who, I don't know, man, I struggled with it because they didn't understand what was happening, right? They didn't understand. She's talking about crazy things, you know. I went to go see her in the hospital one day, and she was talking about these people who were coming into her room and they were going to kidnap her and take her away, you know. And I had family members go, "No, that's not happening to you," you know. How do you can't explain that to somebody who really believes this is happening? You know, when Alzheimer's kicks in, it's terrible and it's stressful on the whole family. But it's interesting. I kind of went off on a tangent, but it's interesting because it sounds like the copper peptide, as you describe it to me, and I'm sure there's other stuff out there, but I feel like that is something that is something most people can benefit from, even as something that's just kind of preventative, right? Like, I didn't learn this till recently, where you're talking about the blood vessels and the layers and them moving. It's basically, like you said, pumping the blood through. We don't ever think about that kind of thing. You know, we don't think about the signals between the brain and other parts of the body and what's going on there. And in your opinion, do you think the copper peptide, for the most part, is something that most people could benefit from, even if they're not kind of pursuing some of the other stuff or whatever? And it sounds like there's portions of the other peptides that could probably help. But the copper peptide sounds fucking amazing.
It does, yeah. I would say that one and BPC 157 are probably the two. Nothing is 100%, but we'll say the most universal peptides for people, because they combat so many things that are associated with age-related health decline.
Yeah.
Truly, truly critical. And to your point about getting the blood work and getting diagnosed and all these things, knowledge is power. And when you know better, you can do better.
Yeah.
And when you know better, you can have more grace for people. When you understand what they're going through from a chemical perspective and from a psychological perspective, you can approach people with a little bit more genuine love and care. And so, like, I remember my mom is the nicest. Oh my God. My mom's name is Janice. Everybody loves Janice.
You're a pretty sweet dude too, so I imagine it came from one of your parents.
If anybody, it came from her, for sure. She's just such a wonderful human. I always say they don't make people like my mom anymore, you know?
Yeah.
She's one of those kind of moms, and just ladies in general. I remember when she went through menopause. For a couple of years, my mom was mean. Like, she was mean to everybody. She was short-tempered. I remember my mom getting flush. You know, she's having heat flashes, and she was sweating. I had friends that were going to come over, and she said they could come over. And then right before they came over, she would change her mind and, you know, all kinds of things. And my mom went through that by herself. Nobody supported her. Nobody acknowledged what she was going through. She may have even felt shame to go through menopause, which I think happens because a lot of women associate it with they're no longer a youthful woman, right? Which is not true. And in fact, in the case where it's appropriate to introduce bioidentical hormones, they can now feel like they did before they went through menopause. And they can maintain that sense of femininity that they had, which is so important for quality of life. It's just like men.
Sure.
We don't want to lose our positive masculinity as we age. We don't want to become frail. We don't want to be viewed as somebody that's not dangerous anymore or powerful, even though, you know, in my opinion, masculinity is not exerting your power. In fact, that's one of the least masculine things you can do. Masculinity is having the power and the restraint to exert it on people. But if you lose that even capacity to have the power, that can harm your masculinity. And the same thing happens to femininity too, right? They lose these things that they associate with that. And if we have a healthcare system that allows us to have those conversations with people, and it allows us to help them understand what's going on and educate them, and then give them tools to regain that or to maintain that core piece of their life, I mean, my goodness, what more could you hope for somebody?
You know, I think most people, the difficult thing is when you no longer feel useful and productive, or, you know, and I mean that in a sense, you know, for a lot of guys, it's like, can I contribute still? You know, can I physically contribute? You know, I think for a lot of women, it's, can I emotionally contribute? You know, and I think when people feel like they are, for whatever reason, and they don't understand why, you don't understand chemically what's happening in their body, you know, maybe it's because of just not having exposure to that information, or not even, there's a lot of times, man, even for me as I get older, I feel like I might be, I'm like, are you getting dumber? But it's almost like I sit there and go, there's so much that I don't know, you know? And so I start running across these issues, whether it's medically or why do I feel this way, or why am I, you know, constantly lethargic? And then everything you hear on the radio or on TV, you know, every single medication, it's like, are you fat, out of shape, lethargic, and your wife yells at you? And it's like every single one of them. And it's like, yeah, maybe I need that. Maybe I need that. But it's kind of like we don't understand how our bodies are changing. And a lot of times we can feel useless, you know? And I think that once we start feeling that way, that's when you start letting depression creep in, you know, and that's when you start impacting other family members. And I think that it's important for folks to understand that their body's going to change, to understand, hey, something's different and I don't know what it is. I need to go see my doctor, right? But also for family members to acknowledge it and to be able to, you don't have to be a jerk and go, hey, Justin, you're real different these days, you know, but to be able to understand, hey, things are changing and they're probably changing for a reason, you know, and maybe we should have a conversation. You know, I think there's so much out there that people can take and to make them feel better or do things better. You know, I don't ever want to take away from how we started this, which was, hey, eat correctly, exercise, get sleep, stay hydrated. It's like, okay, once we get past all that, I still feel like crap. What else is going on here? You know, and that's where you need to really, my mother-in-law died of cancer, I think it was like 12 years ago. And my parents were very different from her. My parents were of the mindset of, hey, the doctor told me, and that's what it is. Like, I'm not going to question anything. I'm not going to ask another doctor. I always go to this guy. This is what he said, and that's it. My mother-in-law was more of an advocate for herself, right? And she would take what a doctor would tell her, especially through her time with cancer. Take what the doctor said, and she would literally even say at a certain point, I don't accept that. I'm going to ask somebody else.
I love that.
And she would do it, man. And I tell you what, I told, similar to my father-in-law, you know, we talked about him waiting till 92 to get old. She had cancer for 6 years, I believe it was. And yeah, she struggled. Things happened. You know, some of the medications were trials and they impacted her negatively. But I only remember her truly having 6 bad months. They were her last 6 months, you know, because she didn't take one answer as gospel. It was like, well, I want to try something else. Let me talk to somebody else, you know, and I think that sustained her for 6 years, you know, or 5.5, you know, to where she was able to travel. She was able to live better. It was so funny because my father-in-law would tell her, Lou, you need to stay home. You need to rest. And she would look at him and say, Bill, I got to go.
Why do you think that approach to life is what sustained her? Because I have 2 reasons in my mind. What do you think it was?
You know,
if you
what?
had to give it 1 word or 2 words.
I think at the end of the day, she wanted to live. That's all it was. You know, I think she truly wanted to live. I think some people are ready to die.
Yeah.
And I think she wanted to live.
Yep. The 2 most powerful things in this universe that hold us together, in my opinion, is number 1, it's love. And number 2, it's hope.
Yeah.
And if somebody tells you something and you are definitely allowed to refute what they say, their reality does not have to become your reality. There are certain things that are facts, of course, right? But I encourage, especially when it comes to health, when it comes to mental health, when it comes to really any aspect of you, that if somebody that you deem as a professional is telling you something that you refute, that you most certainly go out and you get a second opinion and you interview your medical providers to find out if they have the same outlook and philosophy on health that you have.
Yeah.
Right? There's one person in particular, and I treat her entire family, that she's so very near and dear to my heart. She's gone through a lot of complex things over the past few years that have led to a decline in just the way she feels and her resilience. And whenever I started helping her, we've uncovered and unraveled so many things that would have never been unraveled through standard practice. And it's allowed us to not only understand what's going on, but to create a clear path towards resolution so that we can return her not only to the resilient image that she has of herself, but something far greater than she ever was before. Because not only is she more intelligent and in tune with her body, but now we're getting rid of and we're correcting these things that were causing health decline for years before some of these things actually took her into the hospital system. And the same thing has happened with our family, where we've evolved and we've looked into things and they've refuted standard orthodoxies that are labeled as gospel, if you will, in traditional medical practice, which are things that are based on outdated views and a very closed-minded appreciation of how the human body works, without a full detailed appreciation of what's really taking place within these people. And as we have gone through these deep dives and we've extrapolated the layers, there's been failures, there's been successes along the road, but all of those things have been critically important for us to get to this point where major true healing is taking place, right? And so many people don't even think to go down that path. They just accept, well, my father had high blood pressure, and it's about time that I get on that blood pressure medication. He had it when he was 38. I'm about 38 or 40. Yep, this lines up. I guess this is just the way it is for me now. No, man. Why the heck is your blood pressure high? Look at all of these systems that can appreciate your blood pressure, and they can affect your blood pressure. Let's look into what the heck is going on here. And I will say, there's nothing more damaging for your body than to let your blood pressure stay uncontrolled or to let diabetes be uncontrolled. There's nothing more damaging. So do not explore these things in lieu of taking care of the problem in the first place, right? But also, as you're taking care of the blood pressure, start to look into why it's high, right? Look into what is affecting me, because just because you're taking that blood pressure medication and your blood pressure is stable doesn't mean that all of the reasons why your blood pressure is high have even been looked at. In fact, none of them have. A medication, since we're on the topic of peptides, a medication is the equivalent of turning the breaker box off at your house. All the electricity's off now with this particular system. So yeah, you don't have any electricity problem now. You just don't have electricity.
Yeah. Yeah.
Which sometimes that's what you need to do. Sometimes you got to cut off the electricity because this is such a bad problem. We have to do that. And what I will say about medication is when it is necessary, there is nothing that can be more life-saving and miraculous than medication. When you are in a life or death scenario, when you are in a critical illness, also if you're the type of person that doesn't have the discipline or the desire to look deeper and make change, medication is definitely the path for you. And there's nothing wrong with that. But people need to understand and know that there are options, there are different outlooks, there's different appreciations, and there are deeper dives that we can do into your health that are centered around actually healing the body, not keeping the body on slow drip life support.
I think watching your body deteriorate is very scary, and I think the only way you can truly combat that is to educate yourself on what's happening to you, because not only do you understand it along with your physician, and maybe you can make changes, whether it's yourself making changes or it's introducing peptides or certain medications, but just knowing, hey, this is what's happening to me and here's why. And you can make little changes throughout your life to kind of, turn that around a little bit. But at the same time, not accepting, hey, my dad was on blood pressure 38 and so am I. again, everything negative you describe, it's this guy right here. So we're working on it, doctor. But I want to kind of circle back to some of the peptide stuff. What are some of the peptides you guys are using more frequently in your practice? And what are some of the results you're physically seeing that in your patients? What are some of the results that you're seeing here recently for folks that are introducing some of these peptides into their body?
Good question. So, as you know, our practice is very heavily on sports medicine, right? So, peptides that are in the regenerative and recovery world are by and far what we use the most. So, BPC 157, TB 500, also known as TB4 frag, depending on how it's introduced in the body. Those are the biggest ones that we use, and they work extremely well. They work very well together. The internet world refers to this combination of peptides as the Wolverine stack. Right? Wolverine is the X-Men that had massive healing acceleration capacity.
The best X-Men.
I think Magneto's the best
Oh,
X-Men.
I loved.
See Magneto versus Wolverine. Who's going to win?
I just love the destructiveness of Wolverine's attitude toward things.
Yeah, he's very animalistic for sure. I like the calm, chess-like nature of Magneto.
I love the destruction of Wolverine.
Yeah.
Anyway, go ahead. I'm sorry.
So these two peptides are an example of synergistic peptides that complement each other to work significantly better than they would on their own. Some sources have said that the effects are multiplied by around 7 if you put these two peptides together rather than just stand alone. So what I will say is, BPC 157, this really is the heavy hitter here. New blood flow reduces inflammation at the source. Okay, so our inflammatory sources are these things that are called cytokines. Okay, interleukin 1 and 6, NF kappa B, TNF alpha. Right, these might as well just be all gibberish. These are the sources for inflammation in the body. It works to cleave these things at the source, not just at the site. Okay, it's critically important to understand that, so that we understand that BPC 157 has systemic effects. It also upregulates collagen and elastin. Okay, those are also ground substances for health, for repair. TB4 frag is an immune modulating peptide. Okay, it also mobilizes fibroblasts and actin. Okay, those are other things that are ground substances for tissue repair. So you put these two together and tissues can heal in accelerated ways. I've used this with young patients, I've used this with middle-aged patients, and I've used this with the elderly patients. I've been particularly impressed with how it works for some of my geriatric females.
Really?
Yes, a common condition that a postmenopausal woman, in fact, this is the largest demographic to experience this, is something called the glute tendinopathy or a glute tendon tear. The glute tendon is huge. So when that thing's torn or the tendon is not healthy, it is a doozy to fix. It takes a long time.
It's a big muscle.
It's a huge muscle. This person is also a little bit older. Their hormones are not where they need to be, right? Their muscle mass is also not ideal most of the time. One in particular, she's 70. She just turned 70. We worked for several months on that tendon, and we got some benefit, but it was still a fairly big problem. And we put her on the BPC 157 and the TB4 frag combo. Within the first month, she made 90% improvement.
Wow.
Right? Her pain whenever she slept, it would bother her all the time, that went away. She was able to start barbell squatting. She does CrossFit, by the way. Just a few weeks ago, and this is her 8th week on it, she did a box jump.
Oh, wow.
She's single leg balancing. She's doing things that are like, number one, for a 70-year-old, pretty impressive.
Sure, yeah.
But things that despite, and we use really state-of-the-art sports medicine equipment, right? Despite our integrated approach or a multimodal approach with that, we weren't able to move the dial as far as we wanted to. And she's the one that brought up the peptides to me. Actually, it wasn't even me. I was just so silly that I didn't even think about it for her. And she said, hey, I want to try this. I said, okay, let's give it a shot. And it worked far better than I ever could have imagined.
That's awesome.
Yeah, those work really well. There's another one that I use that I'm very passionate about this one. This is the one that I'm currently taking. We call this one the GI stack. So it has KPV, BPC 157, and lorazepatide in it. I think that this is such a mastermind combination of peptides because it really, really appreciates the way that our systems work. So, okay, we're about to go into this one. So in our gut, we have this layer of cells. So when you take cells and tissues, biology and histology and medical school, chiropractic school, whatever, you learn about the different cell types. And when you know the type of cell, you know what it can be predisposed to, you know the kind of diseases, and you know how it breaks down and how it heals, right?
This is all blood work.
No. This, you can do some of these things on blood work, but this is all how the body works, right?
Okay,
so you need to understand these things in order to know how to heal the tissue, right? And so BPC 157 does all the things that we talked about. KPV, this is an immune modulating peptide, also downregulates these inflammatory cytokines, right? But what it also does is it heals the mucosal layer of our intestines, okay? Whenever you have long-standing intestinal inflammation, which is most people in the United States because of what we eat, other things that can also affect that is antibiotic exposure to mold and environmental toxins, alcohol, cigarettes, processed foods. Those are the biggest guys. Poor fiber intake. The mucosa begins to thin, right? And we need this mucosa because it has these things that are called microvilli. They're like these tentacle-like projections. And they kind of sit like this inside of our intestines, and they pull nutrients in, they move things around. So we need that for nutrient absorption. Well, we have seen on microscopy, which is slides under a microscope, that chronic GI inflammation, those microvilli begin to knuckle, and then they degenerate, okay? So that mucosal layer degenerates, and then, this is the really nasty stuff, we start producing this protein. And this protein was first discovered in patients that have celiac disease, which is an autoimmune reaction to gluten. When they consume gluten, they release this protein that's called zonulin. Zonulin actually takes these tight junctions. So tight junctions are the cell in the intestines. They're one layer thick. They're extremely thin. And they are designed to where there is zero pass-through, right? You cannot pass anything from the intestines out of the intestines. Well, zonulin actually opens up that, and now they become semi-permeable, right? So now things can exit out of the intestines into our bloodstream. That's a big no-no because we start producing these antigens and these white blood cells to food. Now when we consume food, we're having an immune response to the food. So people used to be able to eat a certain food. Now they no longer can enjoy that food because they get bloating.
Is that why pasta kicks my ass?
I knew you were going to say that. It's part of it. It can also be a blood sugar issue, right? Because your glucose can get too high and it can cause, inflammation. But in many cases, it is an immune reaction to food, especially if it happens very quickly after you eat it. And I know so many people that say, "Oh, dang, I can't eat pasta, or I can't drink wine anymore," because what it does is you've produced this antibody to it, and so every time you consume that food, your body starts attacking your intestines and causing inflammation and bloating. Number one. Number two, the unfortunate part of it is many of these foods that we create these white blood cells have the same amino acid chain as other body parts. A really well documented one is dairy. People that have this problem that consume dairy will frequently experience knee pain. Because the chondrocytes in our knees have a very similar amino acid profile, structure, chain as dairy. And so your body says, well, I need to destroy whatever that is. Starts attacking the knees, degenerating the knees, causing chronic inflammation. And it's so nefarious and subtle that people don't realize it.
So, that sounds terrible.
It does, but on the really beautiful aspect of this peptide. And the reason why standing alone, none of these peptides could solve this problem, which is an extremely common GI problem. I'd say it's more common than not common. Lorazepam downregulates zonulin, which allows you to stop the source of what's causing this to separate. So it's able to reclose the tight junctions. The KPV is able to heal the mucosal layer. BPC is able to bring blood flow to this tissue that was damaged. all BPC and KPV downregulate the inflammatory cytokines that are causing the damage in the first place. And these cytokines are the bottleneck, or they're the drain, they're the source of the inflammation that goes throughout the rest of our body. So now you can actually close the barrier, heal the mucosa, bring blood flow, decrease the inflammatory products of having this compromised gastrointestinal system, and start actually absorbing nutrients appropriately, right? So that would be a case where, wow, this person, they really have some very sensitive gut issues. Along with a very specific nutritional intervention, I'm now going to start bringing in this combination of peptides so that they have a greater chance of success, and they can be successful at an accelerated rate, right? One last piece to that, another product of having these cytokines elevated is it can cause this mast cell response, which is an immune system response that creates histamine throughout the body. And that histamine can look like a skin reaction. It can look like an acid reflux problem, right? It can look like neurologic inflammation. So when you consume a food and all of a sudden you have acid reflux, and then you go to your doctor and they put you on a proton pump inhibitor, which, by the way, those and antacids are only in the medical research suggested to be used for around 2 weeks. Most people take them for years, and now they have their stomach acid reduced, which is the first line of defense from bacteria. So bacteria starts making itself into the gastrointestinal system, and you're not able to break down proteins because that's how you break them down, so the stomach acid. So now you have a protein deficiency, and these proteins are this ground substance to produce peptides and a lot of other healing factors within our body. So that's inhibited. Your micronutrient status is inhibited, and then your immunity from bacteria is inhibited. And all of the problem that was causing that in the first place is also still there, right? Which is the gut integrity and these immune molecules that are being produced. So you can see how this creates layers and layers and steps before the symptom actually ever arises. And if you're looking at it just at closing off a symptom, my goodness, you're looking at the iceberg that's this tall out of the water when the big problem's right here.
Yeah. It sounds extremely complicated to me. It probably makes more sense to you. But my question is, what is the process for not just giving folks peptides, but when you're going to stack them like that, that recipe has to come from somewhere, right? Which to me, it's at your whiteboard, right? You're sitting at your whiteboard, you're going, okay, what are the tools that we have? How do they participate with each other? What is some negatives or positives, combining certain things? And so this is what I envision, right? I see you at your office. You're writing all this stuff down. You're putting it together. You're saying, okay, well, this is a great stack that we're putting together here because it's going to affect this, and that. This one's going to do this. It's going to complement that. Now we have a stack, right? Who would this work for? So now we get Gabe walking in, and you're like, this guy's a mess. This stack's going to be great for him. What is that process? Is it, hey, we're going to sit down, we're going to do blood work, we're going to find out what you got going on. Then we're going to, do you introduce a portion of that stack, the whole stack? And then once you do that, when do you come back immediately, let's say 3 days later, a week later, for more blood work to see what's doing what, and then you start adjusting that? And is it like potentially like a 6-week deal where you're kind of like, okay, we got this devilishly handsome fat guy. We got him sorted out. It took 6 weeks. We had to adjust this, introduce more of that. What does that whole process look like for somebody who's coming to your office from zero, right? And you're just meeting them, introduced. Hey, I'm really interested in some peptides. These are my current medical issues. What does that look like for a patient? And how long will that potentially take for you to go, hey, this is the combination for this person?
Super good question. So I would say the most common way that this takes place is patients will say, hey, I want to set up a blood work eval with Dr. Reyna. So what we'll do is we'll order the labs first, because if we order the labs first, we have a really strong baseline of information to go along with the health question and history that we'll have when we sit down. So we have this set of labs, and it's complex. It's set in a systems approach. Then we'll sit down with them and we'll say, okay, this is what's going on. Okay, we may need to order additional labs. We may need to order specialty labs. And what a specialty lab is it's something outside of the blood work realm. It can be a stool test. It can be a mold test. It can be something that's called an organic acids test. It can be a heavy metal test. It can be all kinds. It can be a food sensitivity test. It can be all kinds of different things. If we have to do that, then we'll have a follow-up and discuss those things. But most typically, if we're doing labs, patient comes in, they say, okay, this is what's going on. I run through everything that I'm seeing on their labs, and I correlate their symptomology with what's objective. Okay? What I don't do is I don't look at one lab and I say, this is what you need. We have to create a clinical picture. I'll look at labs and I'll find 5 or 6 different things that are pointing to this health system. And I'll say, okay, this is the compromised health system based on your symptoms, on your health history, the medications that you've been on or have taken, the illnesses that you've had, etc., and what we're seeing on your labs and how everything's interacting. Because of that, and I always go to my whiteboard. That's why I have that beautiful, sure. It brings me so much joy, right? And we'll run through it, right? Because you have to draw these diagrams. You have to talk to people about these molecules. You have to educate them on all these different things. And we'll say, okay, I think you need fish oil. I think you need a probiotic. I think you need fiber. And maybe you also need berberine or whatever. In conjunction with that, this peptide is going to be supportive for all of these systems within your body. And most typically, we may do a trial of care that lasts somewhere between 8 and 12 weeks. And the reason why we'll do that is because it takes time for your body to repair itself. You are limited by matter when you are repairing. You're not limited by matter when you're turning off the breaker box. Does that make sense? Mm-hmm. We are trying not only to reduce what's causing the problem, but we need to introduce things that are going to heal that once we've put a stranglehold on the problem generator. Does that make sense? Yeah. So depending on what we're doing with the patient, it's not uncommon for them to see me again in 4 weeks for a follow-up. And we may run a couple small labs that were critical in that patient and discuss them and then track their progress in that way. And then we may add or subtract some of the different things that we've introduced. But most of the time, there's going to be some initial phase of care that takes around 12 weeks.
Okay. So is it something where, hey, Gabe comes in, gets a peptide shot, goes home for 2 weeks, or is it like, hey, here's a stack of needles with the peptides in them, take them daily? It
depends. So that's a good point. So there are certain peptides that are injectable. There's others that are oral. Okay. And there's some peptides that can only be injectable. And there's some peptides that can be both injectable and oral, depending on what you're trying to achieve and what the patient wants to do. Okay? So for the injectable peptide stuff, what I'll do is I'll educate the patient on the health systems and the mechanism for these peptides, and then I'll write a referral to our medical staff, which is our advanced practice nurse and our medical doctor, and they'll screen them for the injectable peptide. And if they're a candidate X, Y, and Z, then they prescribe them, and we'll have everything compounded. We'll show them how to do the injection so they're clear on that. And we'll send them home with a vial, and they'll perform a subcutaneous injection, depending how frequently is dependent on the peptide. So certain peptides you need to inject 5 days a week. Some you need to inject 7 days a week. Some you need to inject once a week. Gotcha. It's really dependent on the peptide. There are some orals. We use a lot of the oral ones because, frankly, they work very, very well, and they're less expensive. And so for the compliance of the patient, it's better because they don't have to inject themselves. They can take it anywhere that they want to, and it's just a lot easier to just take a pill.
Yeah.
So there's certain times where we'll use the pill, or that may take it twice a day.
That's not that doesn't sound too complex, especially on the oral side. I think a lot of people are. Some people get fidgety about needles, but sure. I think being able to take something orally, the research I had done, which was probably not the best. It seemed like it was a lot of injectables. So less oral, more injectable kind of thing. But I guess being able to take something, and again, like you said, not everything can be taken orally.
Correct.
But having that option in some cases is probably going to be good for some folks.
Yeah, it certainly can be. the optics of it are better for certain people. Like my father, for example, if he sees me inject the peptide, he thinks I'm injecting anabolic steroids, right? It's like, oh, son, you're doing something unnatural. What are you doing?
You're going to the gym every day and working out. That's what's the natural part.
Yeah, right. So certain people's belief systems are important to take into account. But there are certain peptides where you absolutely, the only way that they work is they need to be injectable. And so this is a good point. If a peptide is between 2 and 50 amino acids long, that's considered a peptide. If it's between 50 and 99, that's a tripeptide. And if it is above 100, it's considered a protein.
Okay.
Right? So if the peptides have a longer chain, they're more likely to become denatured somewhere in that absorption process. So they need to be injected.
Gotcha.
Okay. An example of that is there's a peptide that's really popular that's called CJC ipamorelin. What this is it's a growth hormone analog. So you take it and it signals to your brain to start producing more growth hormone, right? So certain people take growth hormone, right, which is a more aggressive form, but again, it functions on a negative feedback loop. So you take that growth hormone and you're no longer producing it, whereas this peptide sends pulsatile frequencies and signals to your brain to release more of that growth hormone than you were releasing before, but it won't be greater than physiologic range, which keeps it in a safety profile.
So that's probably a better way to start, as opposed to taking the first. This one, introducing these pulses to get your body to produce is way better to go off.
Certainly, yes. In the growth hormone, it can be, important for certain people that have true growth hormone production issues, right? If they have a true problem, they need the growth hormone. But a lot of people will take it as
probably most people will take it as
a designer steroid, essentially, right? They'll take it as that, not realizing that growth hormone, you take a lot of it, it causes, all the cells in your body to replicate. Okay, that could potentially be quite unsafe in the cancer scenario.
Sure.
There's also a blood sugar intimate relationship between growth hormone. So a side effect of taking growth hormone is your blood sugar elevates. So you can cause a lot of metabolic issues by taking growth hormone. Whereas the CJC ipamorelin is done through biasing your own body's physiology.
Gotcha. Dr. Reyna, let me ask you this. You've grown pretty quick here lately. What services and what staff have you introduced? And if somebody's coming to the modern movement, what services do you guys currently provide with the new staffing that you guys acquired?
Yeah, we've been so blessed to grow at
It's been beautiful, man. I'm excited for you.
Thank you.
Yeah.
A lot of people have really shared that sentiment and excitement. And I think that, the secret ingredient to our growth is that we really truly care about our patients. Like there is a very palpable amount of love that we have for our patients. And we take genuine interest in not only their health, but in who they are. I have conversations with people about their family all the time, or they'll text me and they'll be like, oh man, my dog's not doing well. This and that, like, do you know a good veterinarian that I can take them to or whatever? And they'll text you on a Sunday. And of course I'll reply to them, right? Because it's this community that we've built where everybody is really, truly a family member. Like love is the magic bullet of healing. When I was at the VA, getting my license and everything, I worked under this doctor, and he said when he graduated, he knew that he was not a good doctor. So what he did is he just loved his patients, and his patients always got better. There was this other doctor that worked with us. She did not have that type of sentiment. She was very mechanical, very good doctor mechanically, but her patients didn't love her. And as a result, many of her patients didn't improve, right? So that has been the secret ingredient for our success. So thank you for that. I appreciate that. It's been cool. The services that we offer, so our full staff is, we have Olivia, which is our practice manager. She's like the heart and soul. She addresses a lot of my inadequacies as a business owner. So she's been very critical. Trey, of course, he's our director of rehabilitation. So we do offer comprehensive sports rehabilitation where we utilize state-of-the-art modalities such as shockwave, windback, TechR, NewFit, direct current, dry needling, chiropractic spinal manipulation. And we put all these services, also spinal decompression, we put all these services together. So when people come in, they're not having to go to 7 different providers to get things. They come into one place, and we're providing all of these things within one treatment. So that's one part of what we do. The second aspect is the functional health and functional medicine piece, where we have our advanced practice nurse, Desiree, and our medical director, Dr. Gianni, as well as myself. I work as a consultant on that side, where I'll sit down and I will go through the health systems, I'll do the lab work with the patients, and I'll discuss how everything is interacting. And then, I make the referral over to them where they can either do hormone replacement therapy or peptides or different things that are in the functional medicine world. We also have Olivia Beerley. She's our professional MMA fighter. She's been a patient for the past 2 years, and we're lucky enough to have her now as an employee.
That's awesome.
She's great. She is very much like Olivia, so I have Olivia and Olivia.
Oh, gotcha.
To confuse everyone. They work very well together. They do a lot of the administration piece to the clinic, as well as Olivia managing the social media and marketing, which has been great. And then we have Bobby. Bobby's also one of our rehab specialists, and then there's myself.
Dude, that's awesome. I mean, you guys have staffed up. You've grown really quick. The new place is beautiful.
Thank you.
I think it's in a good location too. So I think your growth and your expansion with the other things that you offer to potential clients, man, I'm excited for you. I think you're a good dude. That helps. The love aspect, I really get that. Everybody that I see interact with you, or even just your social media posts, they're just good posts, man. Like they're fun to watch. I'm sure there's plenty of hard work that goes into what you guys do, but you can tell that there is this commonality amongst you all to where you really enjoy and loving what you're doing. And when you have a staff like that, it just benefits the client. At the end of the day, it might be a fun place to work. You might be learning off of each other. You might be productive and profitable. But at the same time, at the end of the day, it comes down to, are the clients happy? Are the clients getting healthy? And it sure looks like it. So I'm excited for you, man.
Thank you.
Where can folks find you?
So we're located off Blanco and Bitters at the, I don't know the name of our shopping center.
I don't either, but it's nice.
Courtyard something. We're where the melting pot is. So we're a few minutes, I think 5 minutes or 2.4 miles away from 1604 inside of the loop.
It's kind of in the intersection of, what is that, Bitters and Blanco?
In Blanco. Mm-hmm.
Yeah. And then social media wise?
The Modern Movement _
Awesome, man.
And then my personal and doctor one is Dr. Justin Reyna.
Is there anything else you want to share with folks?
Just the thing about the peptides, right, is it's not Miracle Grow, right? It's not a cure-all. I would strongly suggest that people approach them with cautious optimism and not fear, okay? If you're guided appropriately and your provider is competent and trained, which they should be, they should help you screen the risk factors. The potential of what they can do for you is really great. And there is a lot of clickbait online that goes both overestimating the benefit of peptides and creating a lot of scaring or harmful information about peptides that's out of context. So I would encourage listeners to try to screen away from anything that's polarizing in the peptide world and find a provider that they align with and that they trust to go through this process, because it can be something so beautiful and so transformative.
I want to ask you something real quick, and I don't want to commit you to anything, and I don't want like tons of people just swinging by to say hi, which might be a good thing. I don't know. But if somebody's interested in potentially utilizing peptides, how can they go in sure, you've got social media. I'm sure you have a few posts. I know you've been posting things from your whiteboard. But where can folks go, or do you offer anything education-wise where somebody who might be interested in peptides but a little nervous about it can kind of educate themselves a little better? Would it be social media posts or just online? Or is it or can folks drop in and say, or set an appointment with you and say, hey, I'd love 20 minutes with you to go over peptides? And I mean, of course, there's scheduling, right? You've got to have your schedule. can folks come in and sit down with you one day and maybe potentially set a 20-minute appointment with you or a 15-minute appointment to kind of go over peptides and see if it's something for them? Or what's somebody's best option to educate themselves?
Yeah, so you could certainly schedule a peptide educational consult with me,
Okay.
where we sit down and we discuss the processes of how all these peptides work, and then determine if this is something that may be beneficial for you. The thing about peptides is it is somewhat difficult to access reliable information online about them, and it somewhat requires a detailed appreciation of how the body works to understand how to apply them. So I would suggest that whether you come see me or you see a different provider, that you definitely sit down and you talk to somebody that is educated and has been doing this for a while.
Okay. Awesome, man. Anything else?
I think that's it, Gabe.
Justin, I appreciate you. Thank you, Dr. Reyna.
Thanks, brother. I appreciate you too.
Thanks, everybody.
Thanks for listening to the Gabe Molina Podcast.
Yo, Barry.